Now we'll have it and actually talk about another complication of diabetes mellitus, especially the diabetes mellitus type 2. So this is what is known as a hyperosmolar hyperglycemic state. Alright, so how can we treat this state? Okay, so first of all, hyperosmolar, trying to define it, you should know that it's a life-threatening diabetic emergency. It occurs mostly in older adults that have type 2 diabetes. So it's characterized by what? Glucose levels are rising so high, it's extreme, and the patient is dehydrated so much, right? And high serum osmolality, okay, but there's no significant ketoacidosis. Why? Because for ketoacidosis to come in, there's absolute no insulin. That's type 1. But for type 2, at least there's some amount of insulin that is being produced. So key steps in the management is fluid replacement. So patients are often profoundly dehydrated, so you have to give all those intravenous isotonic salines. So after you stabilize them, you now switch towards hypotonic salines. So fluid alone can significantly even lower down the glucose levels. So insulin therapy now, well, if the glucose levels persist, you now have to actually go in for insulin. The electrolyte management, potassium monitoring is essential. If there is hypokalemia, you have to replace potassium. Sometimes sodium and phosphate replacement could also be needed. All right. Then of course, it's usually triggered by a disease condition or a factor. All right. So you basically escort along. I try to pinpoint the infection. I try to pinpoint either stroke, myocardial infarction. If they are taking some certain medications, you have to withdraw, and all of that, you treat along. So keep monitoring for vital signs, urine outputs, glucose levels, electrolytes, and osmolality. Okay, so this is what we got for hyperosmolar hyperglycemic states.